session here. We are gathered here today for a powerful discussion at the cutting edge of mental health and innovation. So our member group name is the Science Tech Club India, that is Innovate, Improve and Impact. Today, program is proudly presented by the Science Tech Club India. Our club was established on June 1, 2024 with the core objective of fostering social impact and individual growth. Our mission is captured in our three guiding principles, that is, innovate, improve. Will introduce our team members. First, meet our driving forces, the Science Tech Club leadership. The vision and execution of the club are filled by a talented team of scientific minds. First is Syed Seher Ali, founder, a pathologist specialized in medical microbiology with expertise in VMLT biotechnology and a microscope specialist. Then Meghna Chopra is the co-founder, bringing academic excellence with a BSc in life science and a MSc in biochemistry. Then we have Karishma Parag, that is HR head and general secretary here, health sciences specialist with a BSc in microbiology and MSc in clinical nutrition. Then Afrin Bano, as I am your host as of now, outreach partnership head, a dynamic representative holding a BSc honors in biotechnology and currently pursuing my MBBS in Uzbekistan. So let's move forward with the perks of per day participation here. So here, our visions and your benefits is our sustainable long-term vision focuses on four pillars here. First, fostering longevity by developing a strategic plan for continued growth, securing funding through diverse revenue streams, inspiring involvement to maintain enthusiasm across the wider community, and measuring impact through clear metrics to demonstrate our value. As a participants, you can gain incredible value. The perks of participation include here is personal growth, that is developing self-awareness and essential life skills, skill development, building valuable professional and leadership capability. Then there is social impact that makes a positive difference in the community. You will also have the chance to participate in captivating webinars and workshops on intriguing topics, wins exciting prizes and competitions such as presentation, quizzes, or NGO drives, and have the opportunity to interact with high-profile specialists in their field. Now, moving forward, our sustainable goal, as I told about fostering longevity, securing funding, inspiring involvements, and measuring impact. Then we have partnerships and collaboration where we connect with community groups, engage student volunteers, and also corporate sponsorships. Then here we have an aim that we inspire other people, share club impact stories to inspire others, and also encourage members to share their personal growth and showcase how the club transform and live communities. Now, moving forward to introducing our esteemed panelist here, as we are honored to welcome two distinguished psychologists whose work perfectly embodies in their innovation in practices. First, our two main guests is there. First is Prithvi Vel sir, that is inclusive clinician. First, allow me to introduce Prithvi Vel, a dynamic psychologist who hold a Masters of Science in Clinical Psychology. Prithvi's career is driven by a profound curiosity about the human mind and a need to understand why a person does what they do. Their academic journey was ignited by a passion for understanding how psychological principles can be applied to improve mental health and well-being. Prithvi sir brings rich experience from key institutions, having worked as an intern in case observation, treatment, and psychometric metric testing at Mulchan Hospital and conducting through case files. Their work also include performing peer counseling sessions and volunteering with residents at various entities. Thank you for allowing me to introduce such a dynamic expert. Now I am delighted to hand over the session to him. Prithvi sir, hello. Yeah, you are audible. Now I am hand over you to the mic so that you can express your points here. Over to you, sir. Thank you so much, Afri, for that kind introduction. So, let me begin with asking first of all, how many of those present here are psychologists or psychology students? You can just raise your hand or use that button there to let me know. Anybody? So, is this visible? Yes, sir, it's visible. You can go on. Okay. So, first of all, let us talk about what mental health stands for in the first place, right? So, mental health and well-being can be defined in a lot of ways. Today, it is defined in terms of whether or not a person has mental illness or not, and whether they are able to deal with, regulate their emotions, how they go through life, and whether they can form authentic relationships with other people. Right. So, let us look at one definition by APA and scrutinize it to a certain extent so that we are able to gain a better understanding of what it is that we are calling mental health in the first place. Right? I hope the slide is visible. Next slide, right? Yes, yes. Okay. So APA, American and a capacity to establish constructive relationships and to cope with the ordinary demand and stress of life. Fair enough for a definition, but it is quite preliminary to begin with. So the thing is that a state of mind characterized by emotional well-being does not involve regulation. A lot of things are left out, like because at certain points of time you are going to face them. But the thing to understand is facing a problem in terms of mental health does not mean mental illness. They are different. So I do have a short amount of time, so if anybody does have any questions, please note them down. There will be a question and answer session at the end of this webinar, as far as I'm aware. Is that correct? Yeah, yes, sir. There is a question session. After you two can speak, after that, all can question. Right. So, let's begin with self awareness, self knowledge, knowing yourself, knowing who you are. What is self knowledge? Self knowledge means those things about ourselves that we are taught either by our parents, by our society, by our family, by our culture, the things that we learn about ourselves from them, and those things that we know intrinsically about ourselves. Intrinsically, as in internally, we are aware of them from ourselves. We do not need another person to tell those things to us. Right? There are we do not know everything even about ourselves. So this is where the unconscious might come, which is my field of expertise and which is the kind of psychotherapy I aim at practicing. So think about this for a moment. What are some things about yourself, about your own life, that you cannot remember? Let's suppose, do you recall the name of your second grade English teacher? Do you recall the name of that English teacher's daughter that came to school that one day? There are limits to our memory, there are limits to what we can remember about our own lives as well. Even events that happened in our past determined how we are today, but even then they might be unknown to us. That is where mental health and the unconscious relate with each other, right? Because somewhere or the other, what you know about yourself defines what you can do with your life and what meaning you are going to make out of your life. So there are now certainly two definable parts of you. One that you can say, for example, you can know your name, you can know your age, you can remember the name of the school that you went to, you can remember the name of the college that you went to, what field you chose, what your mother's name, father's name, your grandparents' name are, but you may not remember everything, and those things can be still recalled here. Those things are between the conscious and unconscious. They are called the subconscious. Say, for example, if you do end up recalling the name of the daughter of the second grade teachers who came to school at one time, that may have been in your subconscious as well. But mostly it is probably
cannot be gained through retrospection or introspection or any of those things. They cannot be found out on your own. So, what does this have to do with mental health? Is the question you might be asking yourself. Let me try to answer that now. So, these are some aspects of mental health. This is a very brief list. Mental health, when defined today, is defined not by whether, as I have said earlier, a person is able to grow, whether a person has the capacity for handling difficult feelings, even very negative feelings, at the same time to be able to maintain relationships. These are aspects that are set aside by most mental health practitioners, unfortunately. And it is given a centrality that whether a person has mental illness or not, which is something that I disagree with personally on a professional level as well as on a personal. So these are the aspects that I would like to talk about when it comes to mental health and that you can somewhere or the other look for within yourself and within other people. And an interesting thing is that not all of them will be present in anybody, but not all of them will be absent in anybody either. So let us go on. First three are central to any list of aspects of mental health and well-being. These were the things that when Sigmund Freud, if you know who he was the father of psychoanalysis, not the father of psychology as is oftentimes misconstrued. He gave the answer that whether a person has these three capacities or not defines how mentally healthy they are in their own life. So the first, capacity to work. Now this does not mean that you have the capacity to hold a job, to be employed, to be able to earn money in your life. This means more of whether or not the work that you do is meaningful, whether or not the work that you do is something that gives your life purpose, whether it gives you a sense of generativity in your life, whether you enjoy doing what you work as well. Which brings us to the second part, the capacity to love. So these are interrelated, mind you, because the capacity to work also is defined by whether a person is capable of love. Whether a person is capable of love will define whether they are able to define purpose within their work life. Right? If a person loves art, for example, or loves making movies, or loves painting, any of these things, these will also give that person, him or her, a sense of purpose in their life. But capacity to love here also means another in different aspects, in different relationships. Love can be defined in very different ways. Say, for example, a mother's love for her child is about devotion and even sacrificing a part of their own well being for the sake of the child's well being. Uh, intimate relationship between two people in the romantic sense of the word can mean a very different thing. It means loyalty, it means devotion as well, and it means also sacrificing mutually for each other and at the same time taking care of yourself and the other person at the same time. So, love is not easily definable in terms of what we perceive of it as being something that is to be idealized or a person being idealized. Something being idealized is not love according to our for our purposes, right? And the capacity to play, the capacity to be able to enjoy something, the capacity to be able to love something that you do, but not for the sake of attaining some other goal out of it, for the sake of it, for the sake of it. For example, a person might not be an artist by profession, might not be an artist by work, but they might be an artist because they like to play with me. So these are the three central aspects to whether or not a person will be or is mentally healthy today. Another aspect that comes into play is agency. It is also called self-efficacy. It is also called autonomy. Depends on which school of thought we talk about. But agency means that when you are functioning in the world, you are functioning out of your own choice. You are making decisions for your own life. Right? Agency refers to the sense that I am free to choose between a certain number of things in life, and I do have agency that what I want, what I desire, happen. moving towards secure attachments and safety. Now, before I explain this, I think it would be a fair bit relevant to explain what attachment is in the first place. So, there was a study done by Wellbeing, a very famous psychotherapist and researcher, and he came up with this idea that how a child behaves when separated from their mother in their early infancy stage, let's say 6 months, 9 months after they're born, and how they react to this separation can tell us how they will attach to other people in their future. And this is what is attachment. The first attachment of any child is in their mother, and any other attachments they form thereon afterwards depends on this very first attachment. So when it comes to talking about secure attachment means that in this context of the study that I spoke of, the child when separated from the mother did not behave in a way that the child did not want to see the mother again, which is avoided. Nor did the child get too worried, too anxious about the fact that it was separate from the mother. The child had trust that this mother would return to that child. Right? So in this scenario, this is what security means, that the person will certainly return. The child does not have to worry. And when you think that you are okay person, that it is good that you are enrolled, or whether you think that okay, it would have been better if I was not. And this somewhere does stem from the idea that parents themselves were not able to offer the safe space where the child was welcome. But this is a little clinical when talking about the causes of why self-esteem can be high or low. Self-esteem is certainly very important because it decides how we are going to see other people and how we are going to see ourselves. Because the depths that you explore of yourself to the extent that you are able to is how much you can see. Next thing, affect tolerance. And together with this, let's also talk about thought tolerance. Affect tolerance means the ability, the very capacity to bear positive as well as negative emotions without being overwhelmed by them, without having your psychological and emotional resources drained by these affects. Affects your emotion, not the affect. That is it. So affect, yani ki emotion tolerance, comes into play very often in order to be able to maintain a certain level of mental health and well-being. Because if you are not able to regulate your emotions, you are certainly prone more than other people around you to maybe lash out on them, maybe have thoughts about them that are not actually relevant, maybe feel certain ways that are not called for, and so on. Which also connects with thought tolerance. Thought tolerance means thoughts that come into your mind do not overwhelm you, do not overstimulate you all the time, and you can regulate to a certain degree how much you are going to be affected by these thoughts, how much you are going to be prone to or be vulnerable to acting upon these thoughts, that you can see thoughts for thoughts and see reality for reality. Let's take an example to understand this better. So, when it comes to thoughts, thoughts are sometimes considered to be equal to action. This is called magical thinking. That if I think something hard, if I think something for long enough, or if I think something at all for that matter, it has become prone to actually becoming reality. And it is not the case. We see a lot of this happening in obsessional neurosis and as well as superstition. Magical thinking, the name given by Aaron Beck to this kind of a thing, is certainly present even till today. But the ability to go on without thinking, with being in touch with reality, being in touch with reality as well, is thought tolerance and development. Next, we come to insight. So, for those very people who are in fact mentally ill or consider themselves to be not mentally well, how much insight do they have? Say, for example, a person who comes in knowing that they certain level of acceleration of how easily and how to talk about self that is referring whether or not we are able to acknowledge view ourselves as going through time, as being the same person going through, right? So when you are a child and from that time since you have grown up, you have been able to view yourself as the same person more or less, although that person with different feelings, different things happen, relationships have different feelings about those relationships and so on. You know or somewhere are aware that you are going through time and that you are the same person who has gone through everything. Self advocacy is the ability to assert yourself, the ability to say, okay, this is me, this is what I want to do, and I will set certain boundaries with other people because I would like the good thing for myself, for my life. And how is your relationship? You do relationship with your emotions and so on. So let's say you are not star child while you were growing up, you were fulfilled or and those needs vary from food, from the ability to excrete, from having shelter, from being safe, from being made to feel like the world is a trustworthy place, that you are welcome to this world, and so on. So these also differ by the time you grow up. And now, as you grow up, these needs will also increase. There will be needs for safety, there will be needs for self esteem. And according to Maslow, Abraham Maslow is a psychologist who gave this hierarchy of uh, the final need of any human being, which also matches with Ericksonian thinking, which also matches with other psychoanalytic thought processes, is that you transcend who you are. Yourself as construed socially is not something that you attach to till the end of your life, right? And that was the end of what I wanted to say. If anybody does have any questions, they are welcome to ask them now or later after this Mandan's presentation, which is on social media and how to set limits on it. All the best to her, and thank you so much for allowing me the space to do this and talk about mental health and well-being, which is so important in today's world. Afrain, over to you.
Okay. Okay, thank you so much, Prithvi sir, for sharing your valuable time and knowledge with us. We truly appreciate it. Thank you so much for your kind words. Okay, next we welcome Manat Gandhi ma'am, a visionary leader and a practitioner. Manat ma'am holds a bachelor's and master's degree in clinical psychology. She is the founder of Psychic Hub, an organization dedicated to providing crucial practical training opportunities and promoting mental health awareness. Manat ma'am currently serves as a dedicated counseling psychologist at a rehabilitation center where she offers essential therapy, emotional support, and psychological assessments to individuals in recovery. Her efforts, eh, her, her efforts are instrumental in bridging the gap between theoretical learning and hands-on clinical practice. I am delighted to hand over the session to you now. We eagerly look forward to sharing your key insights, practical points, and teaching us something new from your depth of experience. Over to you, ma'am. Good evening. I'll just share my screen. I hope my screen is visible. Yes, ma'am. Okay. Firstly, thank you so much for having me here, and I'm really excited to address all the audience that is here. Firstly, I know it's a Sunday evening. All of you would want to get free, and you must be having your own plans. So we'll do it quickly, and if we can, if it is possible for you guys, I would really love if you guys can also connect and can reply, or if you guys have any questions related to mental health therapy, anything, so you guys can ask that. Right. So firstly, I'll start with the Psych Hub. So I've been running Psych Hub for almost 2 years now, and I'll just tell you about the Psych Hub. So we provide counseling sessions as well as we have internship, workshops, supervision programs for all the psychology students. So we have a lot of psychology students who come to us for internship and workshops. Then our main motive with Psych Hub have been that we do not just provide theory knowledge to the students, because that is what I noticed when I was a student and when I was in my bachelor's and master's, that there are very little spaces around us which actually um, helps us in getting into a confident profession. So that is what we are aiming with the Cypher. And we have almost had around 2,000 students who have been certified from us. Then we are nationally accredited, we are registered, and we are also internationally registered. Now, coming on to impacts of social media on mental health, we are going to discuss about social media, how it affects our mental health. But before that, I'd really like to know how many of you guys use Instagram. Just give me 1 minute, and you guys can raise your hand. Just let me know how many of you people are using Instagram these days. Okay, one. This is one person. Two, amazing. Three. Okay. Anyone else would like to let me know if they are using Instagram, any social media, Facebook, LinkedIn, anything that you guys are using? I think almost everyone is on social media. If not Instagram, maybe Facebook. If not Facebook, we use YouTube. There's so many social media platforms that we are using these days, right? And thank you so much for raising your hands. So, social media, there are two effects that social media gives us. First is the positive effect. Obviously, we learn a lot on social media. There's so much that is available on social media. But there's one con, that is sometimes we start comparing ourselves with people on social media. Sometimes it also affects us. I'd like to know, because this is a non-judgmental zone, and because I am a psychologist, I also deal with people who are affected from social media. But I'd like to know it from you guys. How many of you have ever experienced that इंस्टाग्राम पे किसी का पोस्ट देख के, और फेसबुक पे कुछ देख के it started affecting you, or you were feeling sad, or you were comparing yourself with them? Anyone who would like to, just you can just raise your hand to let us know, and I would really appreciate, because this happens with me sometimes also, that when you see someone else's social media, you start comparing yourself with them. Anyone who has been through similar situations? Anyone would like to raise their hand, apart from people who have already raised their hands? Anyone? Okay. So, coming on to how social media affects our mental health and our self-esteem. A lot of times we make social media a mirror onto how do we look, and we start expecting appreciation. We start expecting validations from social media. For example, if I am going to get 100 likes, then only I am looking good. If I've not gotten, say, 100 likes on my recent post or on my recent reel, then I don't think I am good enough. राइट हम लोग बहुत कनेक्ट कर लेते हैं अपनी इम्पोर्टेंस को फ्रॉम सोशल मीडिया, राइट? सो दिस इज हाउ सोशल मीडिया affects us. Basically, we start comparing perfect bodies, perfect life, how people are achieving so many things, which eventually start creating low self-esteem amongst us, right? We think that we are the only one who are sitting there, but a lot of people are enjoying their life and are doing great stuff in their life. Just a minute, I need this. Uh, then, is my screen visible? Can anyone confirm me? Is it visible? Yes, ma'am. Yeah, ma'am, it's visible. It's visible. Thank you so much. Then we also set a lot of unrealistic expectations. We have anxiety. Now, what there's one thing that a lot of people tend to not understand about social media is that everyone is not showing their real life on social media. We always try to present a best kind of events, best kind of life on social media. If we have achieved something in our life, that is when we post it on social media. If we are having a great day, or we went or to a great restaurant to eat, that is when we post it on social media. So कोई अपने low moments, no one would post when they're crying. No one would post on social media when they're having a really rough day. No one would post on social media when they're fighting with themselves for any concern that they're going through. So that is one thing that we lack to understand, that social media, on social media, people post their best selves. And we start comparing their best selves to our regular selves. That is when the problem starts. Right? Now coming on to digital burnout and the importance of setting boundaries. Has this ever happened with any of you that you were unable to set yourself out from social media, that most of the days or most hours of your days you're just stuck on social media? Is there anyone who's ever gone through something like this? Or I would also want you guys to reflect onto that, how many hours do you usually take out to use social media? Or how many hours do you spend on your screen? I would really want you all to reflect back. If you do not want to raise your hand here, it's fine. But I just want you to reflect back onto this thing. Now, what happens when we are multitasking, but we are constantly on screen? We are constantly waiting for different notifications. We are constantly waiting for different things to come on social media. We get burnt out. We are tired of it. Even if you're not feeling it consciously, your body gets tired of it. Now, what are the symptoms when we are tired of all of these? We get irritated. We are unable to concentrate on different things. Sleep disturbances starts happening. We are feeling drained even after resting. We are having good 8-9 hours of sleep, but we are still feeling tired. Then how can we set boundaries with these things? Like, we can be mindful, in which, say, if you're eating, you're having food, you can avoid social media at that time. If you're waking up early, or if you're waking up, and how many of you usually um, see your phone in 10 minutes of waking up? Mostly, so many of us do that. So we can avoid that. Or have some sleep hygiene wherein we do not use phones for 1 hour before we are going on to sleep. Right? So we can, again, we can set such boundaries which are achievable for us. I do not want to set any or give you guys any advices here, but I just want you to understand few bits and its, and if you even take one thing back home, that would, you know, would mean a lot to me and would complete my work. Now coming on to mindful technology use and digital detox. Anyone who here and understands the meaning of being mindful? Anyone? Maybe they can raise their hand if you have ever heard the word mindful, or you understand what is being mindfulness. I can only see two hands raised. Other than that, anyone would like to engage? Okay, there's one more. Okay. So basically, being mindful is when you are concentrating on one thing at a time. You are using 100% of your concentration on just one thing. For example, if I am eating, all my concentration, all my mind is on eating. Right? If I'm walking, so I'm not using any distractions at that time, all my concentration is on walking. Right? That is how we can also be mindful when we are using technology. In here, what I mean by being mindful is we set certain hours of when do we want to use technology and when do we want to check our phone. Right? For example, there's one few habits that I have included in this PPT. One of those is checking your phone with intention and not out of impulse. Intention of, say, calling someone of, or maybe, getting updates from somewhere, but not out of impulse. That if you are working somewhere, if you're in between a meeting, but still you just want to use your phone. Mind में बस एक ही चीज चल रही है, I want to use my phone. Limiting doom scrolling, which is when you do not even want to see reels, but you're just scrolling because you are unable to sleep. and you're eating food. There's nothing mindful that is happening, but you're just scrolling through Instagram, right? Taking 5 minutes of break. Sometimes what happens is in today's world, we also complete a lot of our work from social media or from technology or from screen time. So if you have your work system, the screen time is important. To use hoga hi hoga. So maybe you can have few minutes of break after 30 minutes, 1 hour, in which you also give relax to your eyes. You also get relaxed, right? Then digital detox. In by digital detox, I do not mean that disappear from social media, do not use social media. No, but all I'm saying is maybe you can give 2 hours where you're not using phone. Maybe if you're sitting with your family, you're sitting with your parents, your wife, your children, there you are not using phone, but you're just being present with them, right? You are not using phone when you're eating, right? और maybe जब हम लोग रात को बैठ के unnecessarily scroll कर रहे होते हैं, उसके बजाय we can go for a walk, we can do journaling, or we can read some kind of books. Now, how can we balance our productivity with our emotional well-being? Now, sometimes what happens is, um, in today's life, there's a lot of hustle culture that is happening. Everyone's hustling, everyone is running in their own race, everyone is going through something or the other, which eventually obviously takes a toll on their mental health. Now, when I'm also talking about mental health, I would like to point one thing here. If any one of you ever plans to go on therapy, please do so, because there's a lot of stigma attached related to therapy and mental health in our country, because a lot of people have this myth that people who are clinically diagnosed or have some mental illness can only go for therapy. Whereas if you're going through some problems in your life, you want someone to listen, you want to vent it out, that is also when you can go for therapy. You're getting confused, there's some transition that is happening in your life, that is also when you can refer a professional help, right? Coming back to the topic, which is balancing productivity with emotional well-being, I was talking about how our hustle culture sometimes takes a toll on our mental health. Now, what happens is जब हम लोग बहुत ज्यादा अपने working hours रख लेते हैं with no breaks in between, just work, and then you eventually start getting exhausted. So your productivity will not be equal to just being busy. Rather, your productivity should be when you're being efficient to your work, you are also mentally and physically healthy. Then you are also putting a lot of energy. If you're just being busy, that doesn't mean that you will be able to get something productive out of being busy. For that, we also need proper rest. We need sleep, proper sleep. We need breaks, and sometimes we also have to say no to prioritize your mental or physical. And by doing all of these things, you will eventually start to balance out your burnout and you increase your creativity. Now, again, anyone from you who have ever faced that because you're so exhausted with say personal life, occupational, social, that now you're just present there physically, but mentally you're not present there. Anyone who has ever been through something like this? Maybe if you want to raise your hand. If you do not want to raise your hand, you can just think and reflect on it. Okay? Now, building, it's the last topic from my side for today, which is building genuine connections and promoting authenticity online. If any one of you uses Instagram for their business, like I use Instagram, Facebook, we have a website of SiteHub, where we obviously promote our business. But while promoting my business, I always make sure that I should be as authentic as I can with the public that is viewing our business. And I can connect with them, I can build genuine connections with them one on one. Right? So whenever they hear about the psych hub, whenever they want to take therapy from us, or any student wants to come to us for internship or a program, they have that trust on me and they have that connection with me. Right? Whereas जैसे अभी मैंने starting में बोला था that social media pushes us a lot of time to just show our perfect version. And we create highlights of all our best moments. I'm sure आप अपने Instagram पे देखा होगा that whenever you open Instagram, there's a highlight section which is there, in which they're just the best moment of that person. And what happens with that is we start comparing ourselves, right? Whereas with authenticity, I mean that you show your real feelings. Sometimes also show your imperfection or your values that you have. You try to connect with your audience one on one with presenting the real self that you have, right? Now, how can you build honest connections, genuine connections? Is honestly talking to them, honestly sharing. Like if I talk about the side hub, I sometimes go on my stories and I try to share what we've been doing from backhand, what we've been going through, what are the good things that are happening in our firm, what are the bad things that are happening, and also support each other. If you have one of your colleagues starting something, you try to support. Then having meaningful conversations on Instagram, or if you're promoting your brand somewhere on any social media platform, you um, post about something which is meaningful, something which the person maybe will take back home, and not comparing yourselves with different followers or aesthetics. Having a great amount of followers does not mean that you will have a great work. Sometimes people who have amazing work do not have a lot of followers. But what matters at the end of the day is your work, not your followers. And when you will do all of this, when you will be authentic, it will obviously build confidence. It will reduce pressure from yourself because you're not comparing yourself with any other but yourself, and it will improve your self-esteem as well. Now, at the end, I also want to conclude the entire session of mine by saying that you do not need to escape technology, you just need to change your relationship with it. Use it in a way that supports your mental health, productivity, and authenticity. And I would also like to end it by saying that if you ever, again, I'm repeating myself here, that if you ever feel like going for therapy, taking a professional help, please don't think twice. And you can also reach out to us. We have a team of professionals who are working. You can Google on the site hub and you will have will see our website. So you can book your session through our website as well. And if you have any doubt related to mental health, social media, how social media connect affects our mental health, I am open to all of those things. Thank you. Okay, any questions, guys? Any question from both the speakers? You can also write your questions in the message box also. We'll wait for 2 minutes. If you have any queries, doubt to ask,
What's the 2 minutes?
Prithvi sir.
Yeah. So the question is, how can a person create a mindset like country leaders? I would like to understand what country leaders are these about and what is the mindset that according to you, Lucky, country leaders have. I was reading a research by Dr. Otto Gottberg today in this regard, and I would like to share some findings from that research with you today, since this question has been raised. Happens such that there is a sense of regression in a large number of people, in a large population. What happens is they tend to look for somebody with whom they can delegate their responsibility towards themselves and towards the country or towards the nation or towards any such actions that they take when they are under that leader. So the important thing to take away is that we should not be looking for leaders outside ourselves. We should be looking forward to how we want to make our lives better, what we want our lives to be meaningful because of what purpose we want our lives to have. Not that we idealize leaders of countries and learn how to handle those responsibilities when in fact a lot of times we may have noticed that a lot of country leaders, CEOs, CFOs, CEOs do not actually handle a lot They just have a lot of authority centralized around them, which serves their narcissistic tendencies. Sort of things. So try to figure out what you want, what you would like to be like. What are your morals? What are your values? Those are more important things than how to be like somebody else. And to mention one more thing, uh, not too lucky, this is for everybody. I do offer one-on-one counseling sessions myself as well, and you can connect with me through Instagram. Uh, my handle I will leave in the chat for everybody to be able to connect. And if you ever need therapy, please feel free to reach out. And I hope, Lucky, I have answered your question, not in a way that probably you were expecting, but I think in a more meaningful way as well. You're welcome.
Any more questions? Anything? If you have any kind of hesitation, you can write your questions in the answer box.
Alini, do you have a question? And Snehal as well has their hand up. Is that the case?
And of course, to you, our esteemed audience, thank you so much for listening us. Your enthusiasm, thoughtful questions, and active participation are what make these webinars successful. Thank you for joining us in the mission to innovate, improve, and impact.